My name is Lindsey Thomas, and I'm going to be doing the intramuscular injection demo into the deltoid muscle. I would first check for the 6 rights of medication administration: right patient, right medication, right dose, right route, right time, and right documentation. I would then check my physician's orders for the order of the injection, which in this case is the Pneumovax 1 milligram intramuscular now. I would make sure that it is also properly indicated in my MAR. I would then obtain the vial of medication for this injection, and I would check for any issues with integrity to the bottle. And then if it's a multi-dose, I would initial it, date it, and time it. And then I would go ahead and pick the right syringe. In this case, it's the 23 gauge needle. And we'll go ahead and clean off the top of the vial. I'm going to take my syringe and then cap and withdraw the amount of air, drop the amount of air that I'm going to get medication to insert in the bottle. I'll insert the needle into the bottle, inject the air, drop the medication, make sure to dislodge any bubbles. I'm going to verify again that I've got the accurate dose, which I do. And at this point, I'm going to recap the needle using the one-handed technique to take to my patient's room. At this point, when I get to my patient's room, I'm going to identify them with their first, by looking at their wristband with their first name and their date of birth, and ask them, of course, those questions. I will also check for any allergies that they may have, and then I would explain the procedure of that the injection is going to be going into their upper arm. I'd have them relax their arm by their side and raise their sleeve, and then the landmark would be found by creating a triangle at the chromium process on the shoulder, and then the injection would go in the middle of that triangle. In this case, it would be just on here like this. I would then put on my gloves. And then I would clean the upper arm location of the injection with alcohol swab, going from the center outward about 2 inches. And then let that spot dry for a second or two. And then uncap my needle. Put the skin. Poke. And then aspirate to make sure that it's in the right location. If there is blood, you would start over. If not, you just go ahead and inject the medication slowly. Pull out. And then dispose of the needle and blot the spot with a gauze, and then remove my gloves and document the procedure in the chart, the dose that was given and location, and that's it.